How heart supply to the upper limb? So from the heart the blood goes to the aorta, and from the aorta there are three branches. Let me show you aorta, and there are three branches I will write here. So first one is brachiocephalic, the second one is left common carotid artery, and last one is left subclavian artery. Okay, now from the brachiocephalic there are two branches come out. These are the simple like this one. Here we have the left common carotid artery, and here we have the right common carotid artery. And here we have the left subclavian, here we have the right subclavian. So right and left, these go to the respective upper limbs. So from the subclavian blood goes to the axillary artery, and here in axillary artery we have 6 branches. Actually axillary artery have 3 parts: part number 1, part number 2, and part number 3. And from part number 1 branches come out, from part number 2 branches come out, and from part number 3 branches come out. So their name I will write here. Okay, first one is superior thoracic, second one is acromiothoracic, acromiothoracic or thoracoacromial. Okay, and acromiothoracic or thoracoacromial have the 4 branches. They are pectoral, deltoid, acromial, and last one is clavicular. Okay, so these are the branches of acromiothoracic or thoracoacromial. And third branch of axillary artery is lateral thoracic. Fourth one is posterior circumflex humeral. And fifth one, so this one is the anterior circumflex humeral, and the last sixth one is subscapular. From the subscapular there are 2 branches come out, and their name is scapular circumflex and thoracodorsal. Okay, so these 2 branches come out from the subscapular. These are the 6 branches of the axillary artery. Superior thoracic artery from the part number 1. Okay, from the part number 2 the 2 arteries come out, that are the thoracoacromial or lateral thoracic. Okay, from the part number 3 the remaining 3, posterior, anterior, circumflex humeral, and the subscapular, these 3 arteries come out from the part number 3 of the axillary artery. Now blood from the axillary artery pass to the brachial artery. Brachial artery have the 4 branches. So let me show you these 4 branches. First one is nutrient foramen, which goes to the first one is nutrient artery, which goes to the nutrient foramen of the humerus. Second one is profunda brachii. Okay, and profunda brachii have their two branches, and these are the radial collateral and medial collateral. Okay, the third branch of the brachial artery is superior collateral and the inferior collateral. So now we get four collateral arteries. Okay, now blood from the brachial artery goes to the radial and ulnar artery. From radial artery it goes to the wrist and hand. The radial artery have one branch, radial recurrent artery. Okay, and ulnar artery have two branches. The first one is ulnar recurrent, artery have two branches, the anterior ulnar recurrent and posterior. Second branch is interosseous, common interosseous artery. Common interosseous artery also have the two branches, anterior common interosseous and posterior common interosseous. Posterior common interosseous, there is one branch come out, interosseous recurrent artery. Okay, so these are the branches of ulnar artery. Now from the ulnar artery blood goes to the wrist and hand. We will speak about in a further next video. So this all about the blood supply arteries and their branches.